I'm Liana Lowenstein, Child and Family Therapist in Toronto, Canada, and I'm pleased to welcome Sue-Ann Kenny-Naziska, clinical social worker and play therapist, who's here to present a technique that can be integrated into the termination phase of therapy. Welcome, Sue-Ann.
Thank you, Liana. This intervention is called the ABCs of therapy, and what it does is it allows the child and the therapist to process and look at the journey of therapy and the child graduating from treatment, being done with therapy, the progress that they've gained, feelings and thoughts that they have about termination. The materials that you need include just a paper bag, and I like to use the alphabet blocks. If you don't have access to these alphabet blocks, you can use magnets that have the alphabet letters on them, or you can simply write the letters of the alphabet and cut them into strips and stick them in the bag. And so I introduce the intervention to the child as we are going to share information about them being done with treatment. So if you would be willing to assume the role of a child, we'll say that you're about 10 years old and we've been working together for 8 months to 12 months and dealing with issues of divorce. And now this will be your last session. So I will then introduce this to you just like I would to a client.
Okay.
All right. So today, since it's your last session, we're actually going to do an activity, and it's called the ABCs of therapy. And the way the activity works is I have all of these blocks, and they cover all of the letters of the alphabet, from A all the way to Z. So I'm going to put them in the bag, and then we're going to take turns. And when it's our turn, we're going to reach in the bag, and we're going to pull out one of the blocks. These blocks have letters on each side. So when you pull the block out, you'll look at the letters that are on the block, and then you will decide which letter you want to use, and we're going to each take turns creating sentences that talk about our time together in therapy. So that can be things that you've learned in treatment, it can be some of the skills that you now have, it can be how you feel about being done with therapy. So we'll take turns, and we're going to end up going through the entire alphabet from A all the way to Z. So if you select a block and the letter on one side of it's already been used, then you'll automatically create a sentence using the other letter. And if you get stuck, we can work on stuff together. Do you understand how it works?
Yeah.
All right. Do you want to pick the first letter, or do you want me to pick the first letter?
You go first.
All right. So I can either start a sentence that begins with the letter B or with the letter Y. I'm going to do Y. Let's see. You've done a lot of really, really hard work in here, and I'm really proud of the things that you've learned and your ability to talk about the divorce and be able to understand it in a way that's been helpful for you.
Choose G or T, so I'm going to choose G and say goodbye, that today is about saying goodbye to you, and I feel happy and sad about having to say goodbye to you.
I feel the same way. I have some mixed feelings about that. I'm really proud of you and happy that you don't need to continue coming, but also sad because I'm going to miss seeing you. All right, I'll do one more. In or M? Let's see. I will pick in, and I will say nice being able to have you trust me and share with me some of the things that you've struggled with. So you would continue going until you have all of the alphabet covered. A lot of times what I'll do is I will write down the responses that we come up with, and then we'll usually create a poster, either type it out on the computer or the child can do one with crayons and markers, and then that then serves as the transitional object. If you've done a scrapbook with them in treatment, they can take that as part of their scrapbook. So that is the ABCs of therapy. And I hope that when people use it, it's helpful.
Thank you so much, Sue-Ann. I love this activity. I think it's so important as therapists to provide our clients with a positive termination experience, and I think this is a great technique to facilitate that. So thank you for sharing it.
You're very welcome. Thanks for having me.